Hey, it's Michael Maxwell here from Total Body Health and Somatic Senses. I want to go through an exercise called 5 months sideline. We're going to do this with some implements to add resistance to the exercise, which I find especially beneficial for things like trochanteric bursitis, glute med tendinopathy, but also for low back pain. So what we're going to do is we're going to set up into a sideline position. Now in this sideline position, you're not sinking or melting to the floor, but rather you're engaging or pushing the downside shoulder into the ground. Now if you do this, you should have a small space underneath your ribs so that you can shoot your hand through there. So not sinking to the floor, but engage down into the ground with your shoulder, but also your downside leg. So you're pushing down to the ground with my right knee and my downside shoulder, okay? Now this top leg is going to hang out up here. And now in this posture we can do things like rotations. So we're rotating over the downside shoulder and hip. Or we can do flexion extension through the lower extremity. While we're doing that, we're trying to keep a very stable position through our pelvis, nice long upright spine. Okay, so tall and strong through the floor. So what I like to do is add resistance to this. So we're going to take this plate and I'm going to put it on my knee. So I'm going to engage down to the ground, both knee and shoulder, and then I'm going to lift my leg to hold that weight up. Nice long line through the top of my head, tall and strong through the floor. So in this position, like I said, I can do rotations where I'm turning the body down and turning it up. As I'm doing this, I'm trying not to sink into the floor. So my right downside knee and elbow start to really engage into the floor as I turn forward. It's quite challenging in that position, gripping down to the ground and then coming back up. The other thing that I can do is I can work flexion extension. So I'm trying to keep my leg high into this supported position, balance that weight, step it forward and back. Now, the other option is just to hang out here. So pick a position, a line of tension that you desire, and hang out, hold strong. Okay, so the other option outside of using a weight is to use a band around your knees. Exact same setup for the exercise. So you come down on your side, support down through the ground through the back of your shoulder, down through the ground so your downside knee, so you're pushing through the floor, and then you're uprighting or lifting that top leg up, okay? Hold that position, and like I said, you can hold a static position. You can do stepping forward and backwards. With the stepping forward action, I like to train as much hip flexion as I can without having the pelvis hike up in this direction. So you're trying to keep it nice and stable, control it forward and back. Or we can hold here and we can do a body rotation over that downside. Okay, so that's the 5 month sideline position with some modifications to add resistance to that movement. Now, I usually don't go for repetitions with this exercise. I usually go for time under tension. Somewhere between 30 to 60 seconds, with the goal being towards 60 seconds. Now, if you're doing 60, it should be very difficult to complete that 60 seconds. In other words, you want to add sufficient load to make it challenging enough that that 60 seconds is difficult to complete. I usually do 2 or 3 sets of that on each side. So I hope that helps you out. Again, 5 month sideline position with some added load to strengthen up those hips.